Knee replacement is the most common procedure that we perform in the office. A knee replacement is resurfacing of the end of the worn out cartilage of your knee with a metal implant. Here's a model of a knee replacement. Most patients are actually very reassured when they see this model because they often think that a knee replacement involves removing a large piece of the bone and replacing it with a large piece of metal. But as you can see with this model, a more accurate term for this surgery would be a knee resurfacing. The clear part here represents your normal bone. So the metal on the end of the femur and the metal here at the top of the tibia or the shin bone represents the knee replacement. In surgery, I make an incision on the front of your knee. The next thing that we do is remove a very small piece of bone that resembles a potato chip from all the different angles at the end of your femur or your thigh bone. Next, we do the same thing on your tibia and remove a small portion of bone. And then we insert the knee replacement using a special bone glue. After this is done, you have a nice smooth gliding surface of your knee joint. The decision about whether or not to have knee replacement is challenging, and every patient is different. Typically, what I like to do is sit down with patients and have a discussion about what are the things that are limiting you in your life, what are the things that you're hoping to get back to, and then we'll talk about how bad your disease is and come up with a good plan. We typically start with the non-operative options, so injections, physical therapy, and medications that can help you. If you've tried these things and you're still frustrated with your quality of life, then sometimes a knee replacement is the best option. For me, my preferred technique is a kinematic alignment. And this is a special new technique in which we put the knee replacement in that matches each patient's normal anatomy. Previously, knee replacements were put in the same way regardless of what someone's knee looked like or the alignment of their knee. So some people have knees that look very bow-legged, some people are knock-kneed, and traditionally we'd put the knee replacements in the same way for all of these patients. With kinematic alignment, a good analogy is it's similar to putting a door back on its hinges. And when we align the anatomy of the knee replacement with the patient's normal anatomy, this leads to a more natural feeling knee, patients recover quicker, and they're able to get back to a higher level of activity after surgery. If knee pain is limiting you or you're considering a knee replacement, we welcome you to come into our office for an evaluation, and we hope to see you soon.